New treatments are available for breast cancer that are more precise and targeted. Here to talk about those treatments, Dr. Julia Schaefer-Cutillo with Virginia Oncology Associates. Thanks for talking with us today.
My pleasure.
All right, doctor, let's start first with a diagnosis. Once a woman gets a diagnosis for breast cancer, what is the process for her?
So when a woman is diagnosed, usually she's referred to a surgeon first, and the surgeon will evaluate her for the appropriateness of surgery. And if surgery is deemed appropriate, they will perform the surgery and then send the patient to an oncologist such as myself. Sometimes they will send the patient to us first if that's deemed necessary. But in most cases, it's a multidisciplinary approach. So multiple physicians are involved, including a surgeon, an oncologist, which is a medical oncologist, and a radiation oncologist.
When talking about treatment, is chemotherapy always necessary?
That's a great question. So a lot of people think it is, but actually that's not correct. There are many cases when women do not need chemo. Chemotherapy is a very serious decision, so it's a very extensive discussion between the oncologist and the patient. And there are many factors that go into that decision. So one is the age and the health of the patient, different factors such as the stage of the cancer, whether or not it's spread or not, whether it's in the lymph nodes, and also the subtype of breast cancer is very important. So for example, estrogen positive breast cancer sometimes doesn't need chemo, and we can use molecular studies to help determine who among those women actually need chemotherapy.
We were talking earlier, and you had mentioned there's some exciting new treatments ahead for breast cancer. Can you tell us more about those?
Yeah, so we're always looking for exciting new treatments that are more targeted and less toxic in oncology to fight cancer cells. So one really cool new drug is called an antibody drug conjugate, and it combines chemotherapy, which works on rapidly dividing cancer cells, but also causes some side effects because it works on other cells that are rapidly dividing in the body. And we attach a tiny amount of that chemotherapy to an antibody that specifically targets the cancer cell and directs the chemotherapy right to where it's needed, right to the cancer cell, thereby eliminating the effects of the chemotherapy on the rest of the body and delivering it right where it's needed to the cancer cell. So less toxic, more targeted, more effective, and really exciting for breast cancer and other cancers as well. And we're doing the studies right here at VOA.
Very exciting, as you said. If people have questions, where can they go for answers?
Our website is probably the best place, virginiacancer.com.
Doctor, thank you so much.
Thank you.